Today I'm going to be covering chapter 6 of Geriatrics and to get a better understanding of drugs and how they affect the aging body. So I just want to go ahead and clear a few small things up real quick. First off, when I use the term old patient, I'm meaning 65 years of age or older. That is a classic textbook definition, and I mean no offense when I say older patient or older people. So let's go ahead and get started. So we're talking about drugs and aging in senior citizens or geriatrics. There's a lot of variables that come into play that you have to be aware of when treating patients. Not necessarily that we're prescribing the drugs, but we have to understand how those drugs interact with the body, how they should be interacting, and common red flags and our yellow flags that we see that the patient may be presenting with due to taking an inappropriate amount of drugs or not enough of the drug. So on average, the number of prescription drugs taken per day by an older patient, 65 years or older, again, is 4 to 5 prescription drugs per day and 2 non-prescription drugs as well. Per day, 7 days a week, 365 days a year. That's a lot of drugs. Something that needs to be understood is the benefit versus risk factor when it comes to taking drugs, and understanding what population is typically going to be more affected when we're talking about a risk when taking a prescription drug chronically long term. So typically the age population that is targeted is going to be the older population due to the way the body ages and inability to process toxins and drugs properly. Drugs there's a risk and benefit, a benefit and a risk reward system when it comes to drugs. They serve their purpose in their time. When it comes to the time and place, they serve a great purpose. When it comes to things like managing pain for arthritis, or managing blood sugar levels for diabetes, or managing blood pressure levels for high blood pressure issues or cardiovascular disease patients, they have a tremendous purpose, but they also can have a high amount of risk due to that patient being older. So 3 main reasons we're going to cover today as to why that is an issue is how the body processes the drug, how drugs affect the aging body, and more drugs equals more disorders. So late to middle age population have an increased risk of side effects. Older people, 65 years or older, are 2 times more likely to develop a side effect, a severe side effect compared to those younger than them. So back to how the body processes the drug. As you age, water retention decreases and fat retention increases. Unfortunately, it's just the way our bodies age, if we let them. So with that being said, a lot of drugs and prescription medication are fat-soluble medications, so then when you take them, they will stick to those fat molecules in your body, and your body will hold on to those toxins, if you will, longer, and therefore producing a higher effect, if not a higher dose in the body, and creating unwanted side effects due to that. So solutions to help kind of handle how to minimize how the body processes the drug is to take smaller doses initially to see how the body responds, or to take fewer doses throughout the day. As we know, the liver and kidneys change throughout our lives, and their ability to function unfortunately can decrease, and so the body not being able to detox, the liver not being able to detox the drug or eliminate it via the kidneys out of the body goes down exponentially, therefore increasing the effect on the body of the drug a lot. Now, how the drug affects an aging body specifically is older people have an increased sensitivity to most things, and that includes drugs specifically. Other than things like hearing and seeing, they don't really have an increased sensitivity to those, but older patients, sorry, I lost my train of thought there. drug's attendant effect is going to be stronger due to the increased sensitivity, such as if a senior patient were to take a sleeping aid, that sleeping aid can cause a lot different effect to their body because they're so highly sensitive to the medication that they're taking versus a 25-year-old male or female who has high metabolism and can process the drug a lot quicker. So that was just kind of a brief example. Main reason how drugs affect the aging body is going to be the anticholinergic effect that is produced due to certain prescription drugs. Just to kind of recap what anticholinergic effect is, it's when there's a blocking of the acetylcholine receptor, and therefore acetylcholines decrease and anticholinergic effects increase in the body. And some of those symptoms include being dizzy, confused, blurry vision, constipation, lightheaded, difficulty starting and stopping urinating, and urinary incontinence. So just a few touch points on acetylcholine. It plays a major role in neural memory. It helps with alertness, attention, and learning. Main thing is with skeletal muscle contractions, and it works heart, blood vessels, urinary and digestive organs. So it plays a major role. And a lot of times when you take these drugs, such as antidepressants, antipsychotics, antihistamines, have an anticholinergic effect due to it being one of the side effects. So as a health practitioner, you have to keep that in mind when prescribing these drugs to older patients, because they could have an issue, and that issue can be exacerbated due to a side effect that you're not even aware of. But last but not least, more drugs equals typically more disorders, meaning increased drug interaction in the body. If you're taking more than one prescription drug, how that drug's going to interact with that other drug you're taking for another condition often can cause an interference in how that drug works, and it can produce undesired effects in the body. Either the drug isn't going to work properly, so neither of the conditions you're trying to fix are going to be pointless or useless, or it'll have a negative effect and cause other severe side effects that are unwarranted. Some ways to manage drugs and risk-benefit reward systems in the senior population is going to be specifically understanding the patient, open line of communication, what prescription drugs they are taking, which ones they're not taking, and so you have to, having a close relationship with a pharmacist or their MD as well is wonderful practice in maintaining that your patient will stay healthy and that they're on the right drug schedules. And making sure, other ways is to help with scheduling the drugs, like the Monday through Sunday pill buckets. Those are fantastic, so you don't have to, the patient, if they were to have memory loss issues or issues remembering things like a lot of us do, regardless of our age, that happens to be a wonderful way to keep them on task and to keep the drugs in their systems efficiently and properly. And end goal is to understand that there are benefits and risk in prescription drugs and over-the-counter medications for the geriatric senior population, but to understand the importance and the role of when they're important and how they are important.